What is spinal stenosis? Spinal stenosis is a medical condition characterized by the narrowing of the spaces within your spine. This narrowing can put pressure on the nerves that travel through the spine, including the spinal cord and the nerve roots that branch out from it. Think of your spinal canal as a tunnel. Over time, due to various factors, the walls of this tunnel can thicken, or things can start to bulge into it, reducing the space for the nerves that run through it. This compression can cause pain, numbness, weakness, and other neurological symptoms. Spinal stenosis most often occurs in two areas. Lumbar stenosis, lower back. This is the most common form. It affects the nerves in the lumbar region, often causing pain and symptoms in the legs and buttocks. Cervical stenosis, neck. This type is less common but can be more dangerous because it involves the compression of the spinal cord itself, which can affect the entire body. Causes. The most common cause of spinal stenosis is the aging process and the cumulative effects of wear and tear on the spine. Osteoarthritis. This is the leading cause. The cartilage that cushions your vertebrae breaks down, and the body may respond by growing bone spurs, or osteophytes, that intrude into the spinal canal. Herniated discs. The soft, gel-like discs that act as cushions between your vertebrae can dry out with age. Cracks in a disc's exterior may allow some of the inner material to bulge out and press on the spinal cord or nerves. Thickened ligaments. The tough cords that help hold the bones of your spine together can become stiff and thickened over time, bulging into the spinal canal. Spinal injuries. Trauma from accidents can cause dislocations or fractures of the vertebrae. The subsequent swelling or displaced bone can narrow the canal. Tumors. Abnormal growths can form inside the spinal cord, within its membranes, or in the space between the spinal cord and vertebrae. Congenital stenosis. Some people are born with a small spinal canal. Symptoms. Symptoms often develop gradually and can vary depending on the location and severity of the stenosis. Symptoms of lumbar stenosis, lower back. The classic symptom is neurogenic claudication. Pain, cramping, or aching in the buttocks, thighs, or legs. Symptoms are typically worse when standing or walking for prolonged periods. Relief when leaning forward, sitting, or crouching. This is often called the shopping cart sign, as people find relief by leaning on a shopping cart. Leaning forward flexes the spine and temporarily opens up the spinal canal. Numbness, tingling, or weakness in the legs and feet. Back pain, although leg symptoms are often more prominent. Medical emergency. In rare, severe cases, lumbar stenosis can lead to cauda equina syndrome. Seek immediate medical attention if you experience loss of bladder or bowel control, severe or progressive numbness in the saddle area, the inner thighs, groin, and buttocks, severe weakness in both legs. Symptoms of cervical stenosis, neck. Neck pain, numbness, tingling, or weakness in the hands, arms, legs, or feet. Problems with balance and walking, feeling unsteady. Clumsiness or loss of fine motor skills in the hands, for example, difficulty buttoning a shirt or writing. In severe cases, it can lead to problems with bowel or bladder function. Diagnosis. A doctor will typically diagnose spinal stenosis through medical history and physical exam. Your doctor will ask about your symptoms and perform a physical exam to check your muscle strength, reflexes, balance, and how you walk. Imaging tests. MRI, magnetic resonance imaging. This is the gold standard for diagnosing spinal stenosis. It uses a powerful magnet and radio waves to create detailed images of soft tissues, including nerves, discs, and ligaments, clearly showing areas of compression. CT scan. A CT scan can provide detailed images of the bones and can show the shape and size of the spinal canal and any bone spurs. A CT myelogram, which involves injecting a contrast dye, can make the nerves show up more clearly. X-rays. While X-rays can't show stenosis directly, they can reveal bone spurs, disc space narrowing, and alignment issues that may be contributing to the condition. Treatment options. Treatment aims to relieve pressure on the nerves and manage symptoms. It usually starts with conservative methods. Non-surgical treatments. Physical therapy. A physical therapist can teach you exercises to strengthen your core and back muscles, improve your flexibility and balance, and maintain a better posture, all of which can help alleviate symptoms. Medications. Pain relievers. Over-the-counter NSAIDs like ibuprofen or Advil can help with pain and inflammation. Nerve pain medications like gabapentin or pregabalin are often prescribed to reduce pain caused by nerve damage. Muscle relaxants can help with muscle spasms. Epidural steroid injections. A corticosteroid is injected into the space around the compressed nerves, the epidural space. This can help reduce inflammation and relieve pain, although the effects are often temporary. Activity modification. Avoiding activities that trigger your symptoms, like long walks on flat ground, and finding alternatives, like stationary biking or swimming, can provide significant relief. Surgical treatments. Surgery is usually considered only when conservative treatments have failed and the symptoms are severe, significantly impacting your quality of life, or if there are signs of severe neurological deficits. The goal of surgery is to decompress the nerves by creating more space in the spinal canal. Laminotomy. This is the most common surgery for spinal stenosis. The surgeon removes the lamina, the back part of a vertebrae, to widen the spinal canal. Laminotomy, only a small portion of the lamina is removed to relieve pressure at a specific point. Spinal fusion. If the stenosis is accompanied by instability, a laminotomy may be combined with a spinal fusion where the surgeon permanently connects two or more vertebrae to stabilize the spine. Lifestyle and home management. Exercise. Engage in regular, low-impact exercise like swimming, water aerobics, or cycling. Maintain a healthy weight. Excess weight puts more stress on your spine. Use assistive devices. A cane or walker can help with stability and may allow you to lean forward slightly, relieving symptoms while you walk. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition.